when Danny was young, we noticed that she couldn't open her mouth to a normal range and was always a very messy eater. We couldn't brush her teeth very well, so we decided to take her to the dentist, and they weren't very concerned about anything, couldn't feel or visualize any abnormality. He referred us to a doctor at Seattle Children's. We went down, had a CT scan, and then we headed home. Then she actually called us on our way home from Seattle to tell us that they had found a large tumor.
Well, I was just dropped. I didn't know what to say, I was just like, why am I a kid? So I would take that. I wish with me.
10, 11 days later, we were back over to Seattle for her first surgery. So I didn't find out until the day of surgery that it was non-malignant, but they didn't know what it was.
I was diagnosed with a desmoid tumor, and from then to about 4th grade, I've been doing surgeries to try to get rid of or stop the growth of my tumor, and they finally got it stable. And from then on, I've just been doing reconstruction surgeries to help my appearance.
One of the challenges in patients this age is growth can be a little bit unpredictable. And then when you couple that with radiation treatment, it really makes it hard to prognosticate what children will look like as they get older. The really important part of this, aside from the functional issues, were the psychosocial issues with having a facial difference, being in middle school, going through adolescence, and having all of these things occur simultaneously.
She went from being an outgoing kid to being quite shy. Then when we met Dr. Susarla, he was really good at kind of drawing her out, just getting her to talk about the different things that were important to her. And I think that she gained some hope about how she could change her appearance.
I feel like I used to be very shy because of my appearance, and I didn't like going out, but now I'm really outgoing. I definitely feel more confident to go out with my friends. I talked at assemblies, and then I ran for sophomore class representative, and I won. We also have something called the Brave Warrior Project, and I volunteer with them now. I socialize with kids with special needs, and I just help them with social skills. This November, I have 1 or 2 more reconstruction surgeries, and then that should be it. Dr. Susarla has created, with his team, 3D printed bones that mirror my left side of my face to my right side of my face to make my face more symmetrical.
She was actually very forthcoming about saying, if you see other patients who have similar conditions, like, feel free to tell them about my story and show them my pictures. And being able to show Danny's, course and treatment over time can be inspirational to patients. I think it gives kids hope, but it also gives them very realistic expectations.
I really like sharing my story with people that have similar medical conditions like me, just so they know that they will get through it, and it is hard, but they'll make it. I would say you are enough, and be yourself, because it doesn't matter what other people think.